So a lot of questions we get sometimes with patients in here is they ask, what other treatments do we do besides adjust? So what kind of sets us apart is a couple different modalities that we can use around here. One, the newest thing that we have is called Shockwave Therapy. It's been around for a while. It was first discovered for kidney stones, but now we use it for a lot of tendinopathies. We use it for plantar fasciitis, tennis elbow, golfer's elbow. We can use it for trigger points as well. Muscle knots, chronic pain syndrome is really popular as well. We like to use it usually once a week just to give you enough time to recover. It can leave you a little bit sore, so that's why we want to delay that treatment process. The other thing that we can use, of course, is electrical stim. Electrical stim helps bring more blood flow into the body, helps give nutrients to the muscles and let them relax a little bit better. We as well have lumbar decompression or cervical decompression or spinal traction, whatever word you want to use. It helps elongate that tissue and helps if you have any disc injury. It can take pressure off those nerves and just give a little bit better recovery as well. The last thing that we have, which is not really a modality, it's more diagnostic, is going to be our ultrasound unit. We can go in there and scan real time, show the patient their bone, their tendons, their ligaments, get a better diagnosis. We can also pinpoint what the root cause is of the injury and how severe the injury is, if you need to go to ortho or if we can treat it here in-house. And it helps with patient education as well.
Yeah, a couple other things you might find in our office or a sports chiropractic office. We do something called Graston or IASTM. That's kind of the scraping you might have heard of. That's designed to work on ligaments, tendons, muscles, to cause a little injury to them and stimulate the healing process or break up some scar tissue, break up a trigger point, a knot, that type of thing. Another thing would be the dry needling. Huge.
Yeah,
dry needling is huge. We use that all the time. Not only is it great in office, we even use it on the sideline with our hockey team, where a guy can come off. We can needle it real fast, get them back on the ice, at least decrease some of their pain or issues enough where they can play again. And then, like you said, the shockwave. That's another thing you're probably not going to find typically in your standard chiropractor's office. Oh, and then we got these things sitting here right next to us. We have the Normatec systems. So that's another thing that you'll find possibly in a sports chiropractor system. And that's, if you're not familiar with it, it's a pneumatic system. Go on your legs, hips, arms, and shoulder that increases blood flow, lymphatic drainage, and helps with recovery time. So we use that with our athletes to help speed up recovery time after, let's say, a marathon or a long run, or a pitcher after an outing, a long weekend tournament, legs are feeling sore, that type of thing. So really, in that sports chiropractic office, you're going to see those modalities that are designed to really speed up the recovery of a sports injury and are focused more on those sports injuries.